This is a great question. So I would say the top two, for at least personally for me, and I think with other physicians, is vaccination rates. It is very surprising and understandable. A lot of rheumatoid arthritis patients are very fearful about getting vaccinated because they feel that the vaccination will lead to RA flares, or maybe really put their RA back to when they were first diagnosed. And I understand that hesitancy, and I do understand that fear, especially patients who have been controlled. And also, a lot of these patients are on immunosuppressants, again, like biologic therapies, JAK1 inhibitors, as well as maybe high steroid doses that may play a role in the vaccination response. What I do, again, speak to my patients, I do really refer them to the American College of Rheumatology website and their guidelines. They do recommend that patients with RA, as well as other autoimmune diseases, do get vaccinated because, again, the risk of having COVID and possibility of really severe COVID, it probably is worse than maybe some of the side effects of the vaccine, or maybe a possible trigger or flare. And again, flares can be managed by steroids or, again, with other medications. So I would say giving the patients confidence to get vaccinated at this point, and again, get the booster at this point because they're immunocompromised, is probably a huge challenge in COVID. The other challenge is also getting these patients to come back for follow-up. I know there's, obviously with the pandemic, follow-up has been very, very hard to do because obviously patients are afraid to go out. But I think, again, if they're vaccinated, they will feel more comfortable. But it's important to get followed up because some of these medications can really affect their kidneys or livers or other parameters, serological parameters, and physicians need to be able to keep track of that. So we do have telehealth visits, as a whole in the country that we should utilize, and these patients should get their blood work checked. And again, just check in with the physician to make sure that everything is going okay and that there are no side effects to the medication. And then last, I would say also screening, because we do know, again, RA does affect other organs. And, we want to make sure that these patients are getting diabetes screening, because if they're on steroids, they may be developing steroids, or hypertension or other comorbidities. We want to make sure that they're going to check in with their primary care doctors. They're going to check in with their OBGYN doctors, getting colonoscopy screening. So screening is, reduced screening in the era of COVID is another challenge, and making sure that patients recognize that it's important to maintain their screening.